Welcome back to my dialysis life. As usual, I will repeat my admonition, and that will be coming shortly. What's not happening here is discussion of garments because my life was overtaken by events. OBE, I believe, is the military shorthand or close to acronym for overtaken by events. I will continue with the rationalization that whatever it is you wear, it should be informed by your access points for hemodialysis. Again, I would like you to listen to my plea for subscribing and liking and commenting, and if you will, emailing me with ideas and particularly with encouragement. That would all be most welcome. On the next episode, I will talk about what I call the 4/7 proposition. In brief, it's a discussion about how if you're in center dialysis, you're going to have 4 good days and 3 not perfect days, but it's still a better proposition than the 7 half-assed days you get without dialysis. Meanwhile, I'll talk about no medical device. That's medical. I will speak of no medical advice. Only that I am going to avoid that because of your well-being and safety, as I have no medical training. Also, HIPAA privacy prevents me from talking about patients, diagnoses, treatments, and frankly, I shouldn't be speaking about them. I also want to keep these things kind of quiet because the medical personnel need to be protected. They've got a hazardous lifestyle, more so than you would recognize for their genteel surroundings. And lastly, because my disease seems to be unlike any other recorded so far, it's a kind of a cystic disease. It can be treated somewhat like PKD, but I haven't got PKD. So meanwhile, here's what happened to me medically over the past about month and a half, explaining the sequence of thoughts and events that got to, well, it'll explain itself. Arterial blue for the venous. And normally that's how they get blood out from me through the dialysis machine, cleaned up and then passed on back. But it was this day, I think it was a Tuesday, and a nurse, no, actually, I think it was a technician who may have spotted it first. They looked at my catheter area here and said, Well, they went and got a nurse. This is before even putting me on dialysis. I guess they had me started, but it was while in the process of doing this that they noticed something, because the nurse said, yeah. And then while they were putting things together, another nurse came over, and then a curious technician, and probably a senior nurse, because it turns out that the placement of my catheter had slipped a little bit. I'm going to be pointing at a slit here that you probably may or may not show up even in the video. It's hard to do all this stuff reverse-handed. But, yeah, and also the camera doesn't show it up too well. Anyhow, there is a little slit there where the previous insertion had been. And within, I think, 3 days, they had me hustled back out over to the nearby University Medical Center, where interventional radiology took this whole affair and moved it over about a centimeter and a half to the side, reestablished this with something that makes everybody much happier. But it's still part of the same problem is that while looking after getting my blood cleaned, at the same time having a catheter puts the risk of exposure many, 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 let's call it even feet, closer to your heart. Infection right here is not even a half a hand's width away from your heart. So I had decided that I was going to go ahead with getting a what's called a fistula. This is going to be a place where you have a collision between venous and arterial in the wrist, and it creates this little traffic jam called a fistula that bumps up a bit and gives you access via a needle rather than bunches of cables that are threaded on and threaded off with the catheter. So this got going underway then, but in the process of doing this, actually, I had kind of made a commitment to another group of people involved that I'd consider home peritoneal dialysis. That's, I better tilt the camera for that a little bit more. That's where you get a port down over here and you put fluid in, have it dwell in you for an hour, a couple of hours overnight, depends on the prescription. And you do this all at home, which so I could be able to look after my dialysis needs without having to spend 6 plus, I'd say I spend 8 hours a week driving, just driving to Burlington from Bristol, Vermont to have my dialysis treatment. So getting something done at home giving me that much more time back, plus also freedom to move about and fiddle with all the wonderful toys that I can be introducing over the time, had I been able to do that at home. However, saw another doctor, and so this going to complete my tale, who had looked at me previously for doing peritoneal dialysis and said, no, still not a great idea. And the odds of my doing well with that, I guess, are well enough. They're not odds I would play on any football or basketball game. I don't bet anyhow, but they're not great odds, and they're not bankable odds because it's between him and me. This was a male surgeon. So that leaves me with it. Eventually, this is my future. This will be taken out later on. And this may be a path that more than a few of you will follow. Some of you will be able to make the duck out to peritoneal dialysis. Hope you can. It's a nice way to go for getting yourself cleaned up and having a gentler lifestyle. I'm on hemodialysis, and so I'm going to see if I can move that to home. But it's not going to be happening anytime soon because this has got to mature. It takes a couple of months for this to get into its full glory. And then I have to learn a bunch of stuff about that. So I'll be continuing to report on hemodialysis, and that is in-center hemodialysis, for probably at least another 30 to 35 treatments. That should translate into maybe 9 to 10 more episodes in that particular setting, and probably more because I suspect it's going to be a crutch for me in the long run, since I can take this to any dialysis or any hemodialysis center in the country and probably a few places overseas to have that seen to, as long as the schedule is coordinated and maintained. And I am not yet aware of all the wizardry needed to accomplish that. That for a future tale. Meanwhile, I'm going okay. There's different things on me. Got the bandages and the IV pad here and stitches and sutures and various strips there, and plus this ongoing bandage that gets replaced once a week. So a lot to maintain, but it'll start getting much narrower and much more focused soon as So thank you for listening. I hope that was of some help. If it evokes any questions, please put them in the comments or email me with that or more detailed questions at mydialysislife@gmail.com. Thank you. See you next episode, where I speak again on the 4/7 proposition. Or wherein I shall speak on the 4/7 proposition.